Right now, we're in a crisis of historic proportions. We've never seen anything like this before. Not only a pandemic that's sweeping the country, but also a collapse of our economy. Nearly 1 in 5 workers in the U.S. are facing layoffs or loss of hours due to the COVID-19 crisis. This is a tragic and frightening moment for our country. It is also a wake-up call for how devastating the effects of the climate crisis might be. Imagine what dealing with climate disasters would look like during the fallout from COVID-19. Scarcity, broken infrastructure, social distancing. How are you supposed to help people, take care of one another? This isn't a question of if, it's when. And if we don't act now to respond to both these monumental threats, climate change could make us even more vulnerable to the effects of COVID-19 or future pandemics. A warmer climate can dampen immune responses, and changing seasonal patterns make it harder to predict the impact of viruses. Weather patterns altered by climate change influence the spread of airborne diseases, allowing them to travel farther and faster. And there is very real potential for melting permafrost to unleash terrible pathogens into the world, some of which may be even more deadly than what we're facing now. This is why we need a Green New Deal. The Green New Deal is not just a response to climate change. It is a response to the systems of inequality and injustice that the COVID-19 crisis has made so clear. It is a way to provide the critical economic recovery that our country desperately needs. It puts people back to work and invests in industries needed to rebuild our economy. It is a crucial step to ensure that we build a future that works for everyone. And realizing this vision of the Green New Deal can start right here, in California. Our health and our future is on the line. We need California's leaders to respond to this critical political moment. If Governor Gavin Newsom implemented a just and fair Green New Deal, he wouldn't just be implementing a set of policies and programs, but rather he'd be building a new California that leads the nation by building the framework for a just, equitable, and sustainable new way of life. If we push, if we organize, we can make sure these are more than just temporary measures. They become a part of how we take care of each other on a day-to-day basis. Now more than ever, we need California's elected leaders to protect our health, climate, and future, starting by standing up to big oil. California, one of the largest oil-producing states in the nation, can no longer allow fossil fuel companies to continue drilling in our communities and wrecking our future. California youth will not stop organizing until we end the state's production of fossil fuel and jumpstart a national 10-year mobilization towards 100% clean and renewable energy, guaranteed good jobs, and economic prosperity for all. Join the movement today. Join Sunrise.
Hello, everyone. How's it going? Hello, everyone in the chat. Welcome, everyone. Welcome to Sunrise Bay Area's Earth Day 2020 live stream on the 50th anniversary of Earth Day. Can we get some hype in the chat? Please introduce yourselves. I'll introduce myself. This is the Green New Deal for Public Health panel. My name is Alad, he, him, his. I'm an organizer with Sunrise Bay Area. For those of you who want a visual transcript of the event, we'll be posting a link in the chat where it'll open up a live transcript where you can follow along. And in case you're new to Sunrise, we are a grassroots movement of young people fighting to stop climate change and create millions of good jobs. So welcome to all the fresh faces. We're glad to have you here. We're going to get started in just a few moments, but first we have a few short announcements. So first, I want to acknowledge the land we are living on. I'm living on Chochenyo Ohlone land in Oakland, California. And I encourage you all to also find out whose land you're living on at native-land.ca. And if you want, you can also make those acknowledgements in the chat. And second, I just want us to acknowledge the moment we are in. When we first started planning Earth Day, not even 2 months ago, none of us could have imagined the state we were in, being in the middle of a devastating global pandemic, the need to physically distance ourselves from one another, and shelter in our homes, an economy in free fall with unprecedented job losses, and all in the midst of the climate emergency. But now is not a time for despair. This is not a time to close yourself off. This is a time for solidarity. This is a time to mobilize. This is a time to fight for someone you don't know. The movement is not going to stop just because things are hard. While there is a planet to save, the movement will not stop. So thank you again for being here with us on the 50th anniversary of Earth Day. And there are a ton of ways you can be part of this movement along with everyone in Sunrise Bay Area. Tomorrow at 5 p.m. will be our webinar and Q&A called Just Transitions and a Green New Deal in the Time of Coronavirus. And Friday we'll be calling for change and contacting our elected officials in a virtual phone banking party and demand they support people's bailout. So you can check those out and sign up at sbaearthday.com. And also we have virtual open meetings the next 2 Sundays, April 26th and May 3rd, where you can learn more about Sunrise Bay Area and how to get involved. Chat moderators will also post that link in the chat. We also just launched a COVID-19 mutual aid fund to support our neighbors who are suffering most from the COVID crisis. 100% of the proceeds will be going to 3 groups providing direct aid to our Black, Indigenous, people of color communities, those with disabilities, the elderly, the unhoused, and undocumented folks, so that our frontline communities can pay their bills, get medical supplies, and put food on the table. I also want to give a big shout out to our chat moderators, Mukta and Elizabeth. Thank you so much. Also thank you to the entire team, which you'll soon get to meet. But now on to the main event. Climate change is not just an ecological emergency, it is a public health emergency. And the realities of the coronavirus pandemic show us the massive deficiencies in our healthcare system that need to be addressed because climate change will bring more disasters year after year. So we have brought you an incredible set of interviews we've recorded over the past few days, talking about what a Green New Deal for public health would look like. Unfortunately, we recorded too much awesome content and don't have time to play all of them. However, we will be showing our interviews with John Pearson, who's also known as @Oakland Nurse on Twitter. He is an ER nurse and the Alameda Health System chapter president of SEIU Local 1021. And with Amy Kapczynski, a professor of law at Yale University and the faculty director of the Yale Global Health Justice Partnership. We also have 2 interviews which will be released later on YouTube and podcast form with Dr. Linda Rudolph, the director of the Center for Climate Change and Health at the Public Health Institute, and another one with Sarah Schear and Dr. Ashley McClure from Climate Health Now. But to make up for the fact that we can't play those last 2 interviews today, we actually have Linda and Sarah joining us live, and they'll be taking your questions later in the stream. Hi, Linda and Sarah. Please introduce yourselves.
Thanks for doing this, and thanks for having us here.
Thank you for coming. Could you please let us know your pronouns as well?
She, hers.
I'm Sarah, she, hers, and thank you so much for having us. This is really wonderful.
Thank you. Yeah, we just wanted to get started with a clip from both your interviews that really lays the groundwork of what public health actually is and why talking about it in relationship to climate is so essential. So we're gonna play that.
So the father of public health is Dr. John Snow, and he, in the mid 1800s in London, they were having the cholera outbreak. And instead of, this was even before antibiotics, but instead of just treating each individual person who was dying from dysentery, he used public health principles to identify the source of the infection and got the well in London closed, because that's where people were getting cholera. So that's kind of, the classic example of working upstream, is he wasn't just treating the individual, he was treating the population, which was drinking from a contaminated well. And that, we talk about that in terms of climate change, that we can treat people for, heat stroke. We can treat people for asthma and pneumonia from polluted air from burning fossil fuels, or we can close the source of that common root cause, which is burning fossil fuels. And then we don't have to deal with all the downstream effects. It's the much more elegant solution is actually going to the root. And that's really what I think public health, the wisdom is, the simplest, well, the most straightforward solution is at the root. And that's really why we are talking, about a just transition to protect people's health, is because at the root of so many different complications of burning fossil fuels, we can just kind of simplify it all back to the root cause, which is changing the source of our energy to clean, renewable economy.
When we think about public health, we're really thinking about the health of populations and communities. So individuals make up those communities, but we're thinking about on a broader level in the whole Bay Area, or in particular frontline communities, how is their health impacted by either the coronavirus pandemic or by climate change. And for us, I think, we come to it from a perspective that people have the right to the highest attainable standard of health, that's a human right, and that physicians have had historically a really important role as public health officers within like a formal public health infrastructure, but also to advocate for public health measures during crises. And climate change is a huge and looming crisis, and so we really feel that it's within our role to speak to it as a public health issue.
It's hard for people in the context of being in a true health crisis to think about another health crisis that's happening at the same time. So I want to just pause and acknowledge that, everybody sees that COVID-19 is a health emergency. And I think of COVID-19 as kind of being climate change on steroids. COVID-19 came upon us very quickly. It's moving and evolving very quickly, and it's having extremely rapid impacts, not just on people's health and the number of people that are sick and dying, but also on our economy. Climate change has that same magnitude of impact, but it's not happening at quite the same speed. So climate change impacts our health in a lot of different ways. It impacts our health directly through, for example, injuries or deaths associated with extreme weather events or wildfires or hurricanes or floods. It impacts, or heat illness from extreme heat. It impacts us because heat itself increases ozone levels, and ozone is one of the key pollutants that is associated with respiratory and cardiovascular disease. It impacts our food chains and our food supply through heat and drought and extreme weather, and it impacts our access to water. So really, climate change threatens our air, our food, our water, our security. So it's sort of an existential threat.
I just want to thank you too for working with us on those interviews, and we're really looking forward to releasing those later. I first wanted to ask you guys to kind of introduce some of the work you're both doing. So Linda, we can maybe start with you. Can you talk about the work you do at the Center for Climate Change and Health?
A lot of the work that I do is really focused on helping the public and health professionals in public health and clinicians understand that climate change is the greatest challenge of this century. Even in the face of COVID, climate change is still our greatest health challenge, and that we need to really transform the systems that are creating climate change. Ashley mentioned, the importance of really looking at fossil fuels, but our agriculture system and how it contributes to climate change, our transportation system, our energy system, and also the changes that we're talking about to reduce greenhouse gas emissions also provide these huge health opportunities. So when we act on climate, we're also acting on health. And if we act on climate in a way that's smart, we're also addressing these stark health inequities that have really come to the fore in the COVID-19 crisis. But the very same people that are at highest risk of COVID-19 are also disproportionately impacted by the health impacts of climate change. So these things are so interconnected, and the solutions that the Sunrise Movement and many others are proposing in the Green New Deal are not only going to address climate change, as important as that is as the greatest health challenge, they're also going to address heart disease and obesity and lung disease and osteoporosis and mental health. So it's kind of like, why aren't we doing these things for our health? If there's anything that I hope can come out of our current pandemic crisis, it's a better appreciation of how much we can do if we all act together in a crisis, and that health is a universal value and we really have to pay attention to it, and that people are willing to do what it takes to address a health crisis.
Yeah, 100% agree. Thanks for laying that all out there for us. Sarah, similar question to you. Can you tell us about the work at Climate Health Now?
Yeah, absolutely. So Climate Health Now formed around the time of the climate strike last September, when a group of health professionals from the Bay Area came together at the climate strike. And over time, we've expanded to be a network across the state of California, and we've connected with health professionals in other parts of the country as well. But our mission is really to mobilize the trusted voices that health professionals have in our country to advocate for rapidly transitioning away from a harmful fossil fuel-based economy and towards measures like the Green New Deal that will ensure a more equitable and healthy society. And so we've been finding a wonderful sense of community with each other, having, often had concerns about climate change, sitting in our clinics and offices, but not necessarily having that means of connecting with one another. And so we've been able to now, through that community, and Linda Rudolph has been a huge mentor to our group, to find ways of advocating both within the Bay Area for air quality and land use issues like, the presence of coal in Richmond. And we've also been working on advocating for stopping the issuing of new fracking permits in California. And looking forward, many of our colleagues here, but especially in COVID-19 pandemic hotspots around the country are rightfully kind of fully putting their attention and heart into caring for patients right now. But we are trying to lay the groundwork for health professionals to get really engaged in divest, invest kind of efforts, divesting from fossil fuels within the health sector and investing in healthier approaches. So that's some of the work that we're doing. And then also I'm a part of a group called Medical Students for a Sustainable Future. And I just wanted to share that because it's another group of young people where young medical students, and we just released a video for Earth Day and an op-ed that's also highlighting the benefits of the Green New Deal.
You should all look at it. It's very inspirational.
Not quite the same production quality as y'all's amazing video, but I'll share it in the chat.
Yes, we would love to share that around. Linda and Sarah will both be taking your questions later in the stream. So if you have any, make sure you pop those in the chat. But now we're going to move on to our first video with John Pearson being interviewed by nurse and Bay Area Sunriser, Maria Estevez.
Hello, everyone. My name is Maria Estevez. I'm with Sunrise Bay Area, and I want to welcome John Pearson. He is an emergency room nurse at Highland Hospital in Oakland. He is also the president of SEIU Local 1021 and also a member of East Bay, Democratic Socialists of America. Hi, John. Thank you for being here.
Hi.
Can you tell us a bit more about your background as a healthcare professional and as a nurse, and give us an update on probably the things that are what it's like in the front lines of the fight for against COVID-19?
Yeah, I have been a nurse since 2010, and before that I was a paramedic in New York City. Started out as an ER nurse, also in New York, and then moved here in 2013, end of 2013, and have been working at Highland since the beginning of that year. And what things look like right now at work, it's very inconsistent. It seems like just started to get the beginning of a surge of COVID patients. Testing's not very widespread, so it's very hard for us to tell exactly what's going on. And you know, I've heard some stories from Kaiser nurses like yourself about some of the shortages that you have at Kaiser. We have similar problems at Alameda Health System where I work, and I'd say probably the flavor of it for those of us there on the front lines is everything is it's inconsistent. So to give you some examples of that, management's been saying for a long time we have all the PPE we need, but we're seeing a really dramatic change over the last month in the way that they treat the equipment that we need for all of our patients. It's on lockdown, it's being rationed. It's different from department to department. We've had management giving people instructions to do things like spray their non-reusable mask with cleaning fluids and then reuse it. We've seen management telling workers that they can only have one mask per week. There are some departments that require very specific protective equipment that don't have that equipment at all. I had the experience last week of bringing some donated N95 masks to the operating room, and the boss came around the corner, pointed her finger at the masks and said, "Lock those up." So our experience has been really inconsistent with PPE. We haven't been getting clear communication from our hospital either about number of cases, what the proper procedures are. It's been very confusing, I think, for all of us.
Wow, that is tough. And I actually follow you on Twitter, and I've seen your tweets about the healthcare worker that got fired for wearing garbage bag, and that's just very painful and unacceptable.
Yeah, I think we were all really shocked at how blatant the whole thing was, because our CEO complained in a public meeting that it should be coming up on video actually on the county supervisor's website very soon. He complained, and so did some of the hospital board members, about that nurse's picture wearing the garbage bag, called it political theater, and then a little bit less than a week later, that nurse was fired. it's double it's a double tragedy too, because his wife has cancer and is in chemotherapy, and they're losing their health insurance because he was terminated, just for pointing out a safety problem.
We're trying to protect ourselves and our family, and that's what happens. I'm sorry to hear that. So, okay. So you told me that you were in New York. You started in New York as a paramedic and as an ER nurse there. So you know how it looks like coming into the nursing and actually prior to this pandemic. So going back in time before the COVID-19, can you briefly tell us about the state of the hospital before the coronavirus hit and how prepared the system was for this kind of pandemic?
I think the most important thing for the public to know is that none of the problems that you're hearing about now are new, and that a lot of the death that we're seeing now was preventable. It's been interesting to see two of the things that healthcare administrators go crazy for over the last couple decades contributed hugely to this problem of the lack of PPE. And both of those things come from the auto manufacturing industry. So one of them is called lean management, and it's basically this. I imagine that there's probably something like this going on at Kaiser that you might be familiar with. It's basically a way to get workers to come up with ways to find efficiencies and to squeeze more work out of you per hour. And usually what it leads to is getting rid of some of the workers, because you find ways to get, one worker to do the work of two, that sort of thing. Like our hospital has a lean office, and they have staffers that staff it every week, and they're constantly trying to figure this stuff out. And usually what it ends in is budget cuts, layoffs, and cuts in the amount of equipment and things like that we use, because the hospital says it makes things more efficient. The other concept that comes from auto manufacturing and is very popular in healthcare is just-in-time supply, which means that our supply chains are set up to not have stockpiles and to deliver exactly, what is imagined to be exactly the right amount of supplies at the right time. The problem with that is that it leaves us completely unprepared for a big surge in the number of patients. And that's why our supply chain has totally broken down, because we have right now a huge need for all this extra PPE, and the supply chain is not ready to provide it. Both of those concepts come from auto manufacturing, and our patients are not cars, they're not objects, they're real people. And this is not the way to run a healthcare, to run a hospital system, or to run our whole national healthcare system. And so I think that it's both things, right? It's like, it's an actual lack of supplies because the system's not set up for a predictable natural disaster like this. That's what this is very predictable. It's predictable that we'd have a pandemic. It's also predictable that that pandemic could be respiratory and might require lots of ventilators, respiratory therapists, extra nurses and doctors. We're just not set up for it. And then on top of that, you have the mismanagement, the same mismanagement that led to using just-in-time and lean management.
Well, thank you for that. So going forward, you mentioned you are the president of the chapter on the Log 1021. You organize that, and this represents the workers in Alameda Health System. Can you tell us about the actions that you've been taking in response to this working condition?
Yeah, there's been a really inspiring amount of workers just organizing on their own. Sometimes that happens in the workplace, but we've been seeing it quite a lot. So just to give you some examples of some things my coworkers are doing, in my department in the ER at Highland, a few weeks ago, doctors and nurses and respiratory therapists realized that the hospital was not going to supply us with some necessary protective equipment. One of those pieces of equipment is called a PAPR. It's basically like a kind of a space helmet that covers your head and goes to a HEPA filter and keeps you from breathing in infectious diseases and other airborne poisons. And so we raised a bunch of money. It's actually over $60,000 now. We researched and bought our own. We have 18 of them now that we purchased. They were very hard to find, but we could find them. And now we're having a big fight with the hospital system about whether or not we're allowed to bring them into the workplace and use them. The CEO is playing all kinds of word games and basically doesn't want to cooperate with us. There are lots of other workers organizing around being able to work remotely. They've come up with proposals and all kinds of solutions for ways they can do their work from home so that they can stay safe and keep everybody else safe. Some of those workers have been sticking together to put pressure on their bosses. One group organized basically what is like a sick out for several weeks, and their bosses are kind of in confusion and don't seem to be able to understand how to respond to that in any organized way. Yeah, so we've been seeing lots of activity. We had a press conference a couple weeks ago, and workers were standing 6 feet apart from each other and speaking to the press. We had really great turnout. And 2 hours after that, the CEO announced that they were giving into a couple of our demands around COVID, which was a big win for us.
That's good. That's good. So going forward, I appreciate everything that you have done and the workers at your hospital have done, actually every healthcare workers and everyone out there. So for our audience, what is it that you think they can do to help out in this week? Yeah.
What we need to be doing is calling on our elected officials. And, I think that a lot of these problems, unfortunately, really can't be solved by smaller, we really appreciate all the donations that people are bringing. They actually are helping a lot, but they're definitely not a fix to this bigger problem. What we really need is decisive action at like a state and national level. And so what would that, what exactly would that mean? That would mean the kind of demands that people have been seeing healthcare workers making. Right, the state needs to step in and requisition some of the PPE that's in the private sector. So there are lots of warehouses, corporations, factories that aren't going right now, that all have lots of exactly the kind of protective equipment that we need. It really is out there. Government can come in and buy it or requisition it or say, we're taking it now and we'll pay you back later. There's manufacturing right here in California that can start up, and it's very easy to convert apparently certain kinds of manufacturing to producing things like N95s. That ventilator research needs to kick up and production needs to happen as soon as possible. That sounds like something that actually takes quite a bit longer. There are ways that we could very quickly upstaff the amount of healthcare workers. It's really ridiculous also to hear that there's a huge bottleneck at schooling. Because of the expense of schooling and because there aren't enough schools, we just don't have enough healthcare workers. That's really crazy. We have enough wealth in this country to be able to put people through school. We also have lots of people that want jobs and want to go to school.
And
yeah.
We know that this is not going to be the last pandemic, that if we don't do anything, this is not going to be the last, it's going to keep happening. Yeah. What policies do you think should be included in a Green New Deal for public health? Like besides the ones that you mentioned, like how can we do it in a way that supports the frontline communities who are most affected by this crisis?
That's a great question. I think definitely initiatives that would allow for more people to be able to go through training to become healthcare workers. We definitely need more funding for hospitals and clinics and primary care. And I think, this isn't Green New Deal, but it's a related idea, I think, and it's Medicare for all. If we had universal healthcare in this country, it would actually cut down the total cost that we all pay for healthcare. One of the things that it just really makes me shake my head during this pandemic, especially, is that we're paying twice as much for healthcare in this country than countries that have universal healthcare, and our healthcare system is way worse. It's broken. It's not ready to take care of all the patients in the country. Like, we're seeing that right in front of our faces at work right now. And that's just a huge tragedy, and it's not okay, and it's fixable. It's not just like a problem that fell from the sky. And so I think I'd like to see that sort of stuff happening, right? Like, there should be free college for everybody. We definitely need that in this country to make it a stronger country. But definitely for people going into healthcare professions, there should be free training, because we need those people. We don't have enough of them. And hospitals need to be hiring more, staffing up, and we need to open more hospital beds.
I agree. Yeah, with solidarity with every group and all people, all our members, everyone, we can achieve that. Thank you so much, John, for being here, and thank you for being with us.
Yeah, thank you. Stay safe.
Thank you to John and Maria for that really heart-wrenching video. I have a couple questions for Sarah and Linda, but first I wanted to open it up and see if you had any, thoughts to share in response to some of the stories that John had brought up. Linda, you can go first if you'd like.
Yeah, I mean, John touched on so many different things that I have a lot of different thoughts going through my head. First of all, just thank you to you, John, and all the other frontline workers in healthcare that are dealing with this crisis, and for pointing out all the different ways in which it didn't have to be the way that it is. I think that there's a couple of things that are really important in what you said about that are really also pertinent to climate change. So first of all, science matters, and scientists and health experts have been telling us for many, many years that there was going to be a pandemic. Earlier in my career, I worked in both the state health department and also in a local health department. I was the health officer for the city of Berkeley. And in each of those experiences, we had respiratory illnesses that were novel, emerging new diseases, H5N1 and H1N1. And, we've known that this was going to happen again, and COVID-19 is more transmissible and has a higher fatality rate than these earlier emerging infectious diseases. And that's why we're in the situation that we're in. But, we've also known for years that we should be prepared. Just like the scientists have been telling us for years, we have a problem with climate change. We need to act now. And we also see again that early action really matters. We could have taken action at the beginning that would have beefed up our ability to have the right kind of personal protective equipment. We need leadership to do that as well, which we're not seeing in climate change. We had a stockpile of personal protective equipment, and that stockpile was let go because it was considered too expensive to maintain. So the things that we're seeing happening with COVID should also serve as warning signs that we need to do something different in terms of the climate health emergency. The other thing that's just so sad and also so makes me so angry is that here we have all these essential workers who are essentially being treated themselves as though they are disposable. And that again serves as a reminder that as we push for a transition to a green economy, we need to pay attention to making sure that no one's left behind and that we have a just transition for workers and also for the communities that are impacted by climate change and climate policy. I'll let Sarah fill in all the gaps.
No, that was wonderful, Linda. And what you said about disposability really hit me because I think as medical students, for the most part, we've been relatively protected and spared. Our institutions have tried to keep us off the wards as much as possible, but just the year ahead of me in residency, there are young doctors and then our mentors and nurses and so many who are not getting adequate protective equipment and who are having to reuse non-reusable equipment in ways that John was describing, and it's just deeply painful and worrying to think about that. And I'd be glad to speak to any other questions that you have about that.
I actually wanted to ask you a question about medical school because you're a medical student and we know that medical school can cost hundreds of thousands of dollars and many medical students often leave school deeply in debt. And we see that across other professions. And John spoke about making higher education for healthcare students or for all public education free. So what would the implications of making higher education for healthcare be free? What would the implications be on public health?
I think they would be enormous. I mean, so the average debt that a medical student has coming out of training is $200,000. I know that that's a huge, burden mentally on trainees, and that across health professions, and just there's a huge amount of debt coming out of college as well. But for medical students, something that I see is a lot of residents, once you're able to start working more hours, people start moonlighting to try to pay off that debt. And so that's even more and more hours that they're working when there's already such a high burnout rate among our health professionals. And so that takes away from time to take care of your family or to work on creative or innovative projects to try and make the health system work better for people and to try to combat the climate crisis and, to work on all of these things that I know that so many people in medical training have a heart for. That's why they went into the training. But the debt really burdens us from being able to do some of those things for our communities and for public health. And then also there are very important medical specialties like geriatrics, caring for older adults, infectious disease, where actually as you do more training, the average salary goes down. So, it's important for thinking about building a healthcare workforce that's going to meet the needs of our population, to not really disincentivize people from going into those needed fields.
Thanks for sharing that. Linda, I wanted to ask you, during our interview, you actually told us that you had worked for a union in the oil and gas industry. And I just wanted to kind of like link that to some of the labor movements that are happening now, especially in the healthcare industry. So can you speak more to the importance of strong unions for all workers in response to climate change and this pandemic?
Well, unions are super important because unions stand between corporate power and worker and community well-being, as well as government. Government stands between corporate power and community and worker well-being if it's good government. My first job, my first real job after medical school, after I finished my clinical training, was with the Oil, Chemical, and Atomic Workers International Union. And that union was well known for its attention to health and safety. It was the union that really catalyzed California's right to know law about toxic substances, because workers were not being told what the toxic substances were that they were exposed to in the oil industry. And now we still see the oil industry, and it's decades later, I hate to admit, since I worked for that union, we still see the oil industry basically trying to hide the information and obfuscate the truth about climate change. So, unions really put a check on corporations doing bad things that harm our communities and that harm workers. And also it's unions that brought us weekends. It's unions that brought us 8-hour days. It's unions that have been pushing the most for paid sick leave. All of the things that allow us to really have healthier lives are things that unions have been struggling for. And it's important that we roll back the many, many legal changes that have happened over the past couple of years that decades that have really weakened the ability of workers to organize into unions and for unions to have the power that they need to hold corporations in check.
Yeah, those are all really good points. Full solidarity with unions right now. I want for us to transition to our second video. This is an interview we did with Amy Kapczynski, who's interviewed by a Bay Area Sunriser, Julian Krause-Polk. So we're gonna get to that right now.
Hey there, my name is Julian Krause-Polk. I'm an organizer with Sunrise Bay Area. Joining us from New Haven, Connecticut, I would like to welcome Amy Kapczynski, professor at Yale Law School, faculty co-director of the Global Health Justice Partnership, and faculty co-director of the Collaboration for Research Integrity and Transparency. Thank you so much for being here.
So glad to be here. Thanks for having me.
Can you tell us a little bit about your background and how you started thinking about things like the New Deal for public health?
Yeah, so I got into a kind of thinking about myself as an activist when I was in college. And, you know, around the same time, I'm queer, so I got involved in HIV/AIDS kind of issues and organizing, and ended up as one of my first jobs working for an organization that did HIV/AIDS work. I also worked for a feminist health journal. And so those were ways for me to start to explore kind of how to work as an activist and how to learn about politics. And so when I came into the issues that I write about intellectually and the things that I'm now working on as a professor, I really kind of came into them from the perspective of having come to them because I cared about how the world worked and how to change it. And so now it's been, you know, like maybe decades that I've been working on access to medicines issues, you know, on issues about health justice. And so those are the kind of background for me that led me to kind of try to understand, like, how is it that we have, for example, developed all these medicines that we've made unaffordable to people around the world, even though one of the first things you learn in the access to medicines world is most of the medicines that cost, let's say, $100,000 a year, you know, if you buy them from the company, they cost $100 a year to make, right? So how can something cost $100,000 that actually costs $100 to make? We could make it for everybody, but we're not. Why aren't we? You know, those kinds of questions led me into all the work that I now do about the politics of our economy, how we construct markets, how law can intervene to change that. And always with some kind of health justice angle. And of course, that led me straight into the questions about the coronavirus. So like, how have we created a system that can't really respond adequately right now, that's really failing us all in ways that hurt, you know, people who have been long marginalized and discriminated against the most, but are going to hurt all of us. So how do we get there? How do we fix it? It's kind of from that background that I come.
Yeah, that's great. So in your recent piece in the Boston Review entitled Markets versus Lives, you state that this pandemic has functioned as an X-ray of empire. Before we dive into kind of talking about the coronavirus, I think it'd be helpful to kind of situate listeners with a little bit of historical context. Can you provide a brief history of the policies that have made us so vulnerable to the virus, and explain what about the empire kind of people should be paying the most attention to?
Yeah, so maybe the best way to do that is to talk about a couple of areas in particular. So what we do in that Boston Review piece is we try to lay out like a whole range of things that are making us vulnerable to this virus and that are, you know, going to have to be fixed to kind of get our response on track. But let me just start maybe with two. One is healthcare, and another is the carceral state, you know, kind of our prison industrial complex, or, you know, the way we militarize our borders and prisons. So on healthcare, you know, we have built a healthcare system that is organized around profit, that invests a lot in kind of high-tech care, but that costs a lot to the people who have to get that care, right? We've invested in models of healthcare that are organized around the idea that, you know, people pay for their own care, and it's good if they have what policymakers often call skin in the game, because we don't want people to use too much healthcare. You know, we want to make sure they have co-pays and co-insurance, and and that, they use the right amount, and the right amount is essentially what the market will tell us the right amount of healthcare is. That's a terrible model of healthcare, and it's a particularly terrible model of healthcare in an epidemic. Why? Because it doesn't deal with prevention very well, for example, right? I mean, you're safer if I am safer when we're talking about a communicable disease. But, if you can't afford, a coronavirus test, then that's going to make me less safe. There's ways in which we're all interdependent. And this really connects up to the kind of ecological perspectives that you guys bring to the table, right? We're all interdependent. And if you build a model based on, how can we extract the most profit? It's a short-termism is built into that model. Like, we're not calculating about, because firms are organized to be short-term in the way that they think about these things, and they're extractive. What we're not doing is not like putting resources into the systems that we need. That's like the preventative care, let's say the public health infrastructures, which we've also kind of whittled down. And, we've really cut part of our healthcare, like public health infrastructure over the last 10 years. It's not just Trump who killed off the pandemic response team inside of his own administration, but also states and localities, the kind of austerity approach that we bring. And we've been so committed to, even Democrats in America sort of have undermined the systems we need to have a kind of broader healthcare response that will do things like make available free care so that everybody can have it equitably, and so that we can actually kind of take care of one another as we take care of ourselves. So that's one piece of it, is like we've organized this, that, we've got a healthcare system that's linked to employment. And that's terrible in this downturn. People are going to lose their health insurance. And what are they going to do then? We're going to be, in desperate situations, both personally and collectively, because of that. That's kind of, I guess, one piece of it. Another, the coronavirus is going to be really terrible. It already is, inside of all kinds of institutions where people are in long-term care. And so, one of the, that's going to be true for nursing homes, of course, but it's also really even more so for prisons where, and detention centers, where we put people in harm's way without giving them ways to care for themselves. That's a matter of policy. It's going to spread, we know that prisons and jails spread epidemics, and, we've taken away from people the tools that they might need to protect themselves, and we're putting them at risk. We're throwing them in harm's way, and it's going to make the rest of us less safe. And, we as a country are deeply committed to using police and incarceration as a solution to social problems. And that kind of thing is just, really going to work against us in trying to get any kind of shared protection from this virus.
Yeah, absolutely. So shifting gears a little bit, currently there's a kind of an interesting spotlight on essential workers in the economy, from farmers and grocery clerks to healthcare workers, who typically go unnoticed or underappreciated, but whose lives are now put at greater risk to fight the coronavirus and also to keep our economy going. How has this pandemic revealed how our metrics of measuring economic productivity are completely detached from our values of common health?
It's one of the more amazing things, and this is part of the sort of X-ray of empire, like who's really essential right now? They're the people who are being, required to work. And those are, as you say, the people who staff our grocery stores, the people who drive our public buses, the people who work in our hospitals. Those are people who don't get wages that are commensurate with, the idea that they're essential to our, like, kind of our reproduction as a species. They are typically, the kind of often even precarious labor, right? Where the people who are, picking our crops are, often very vulnerable with respect to their immigration status and other things. And yet right now we need them desperately, right? One of the more hopeful things about the moment is that, there's the possibility of turning that into strategies to empower those workers, because they may have forms of leverage right now that they haven't usually. But it also, I think, in the point that you're making is absolutely right. It shows us who's essential, and then should allow us to recalibrate and say, what really matters is being able to get food to one another, is being able to care for one another when everything is when everything feels a threat the way it does right now, these are the things that we come back to as this is what's essential. And it turns out lots of other things aren't. So why is it that we compensate the other things so much better than we compensate these? That's a political choice, even though it's a choice that I think in our political culture, we treat it like as if the market is a thing that has its own rules and it just does that. Well, that's not the case, right? I mean, not only because you can do things like set minimum wages, and it turns out that economists were wrong that a minimum wages necessarily depress employment. Like, you can do all these things to actually take care of workers. You can require sick pay. You can make unions. Many countries have much stronger unions than we do, and that's the product of policy. There's no such thing as a market that tells us how we have to treat workers. And so those who are, showed up as essential now are those who we really should be focused on in terms of protecting.
Yeah, absolutely. I guess moving on to the getting your opinion in terms of the federal response to the pandemic. It's been pretty clear that the response has been kind of a disgrace, and kind of delivering crumbs to working class folks while corporations are getting this special treatment. Do you think this could illustrate maybe to the average American, or wake up the average American to the outsized influence of corporate interests in our political system and politics, which often gets obscured by petty party politics?
The stimulus is, as you say, it was organized to protect those that matter. And those that matter are really, like, in our political system, are really like, you knew from the first moment that the airlines were going to get bailed out. There was never any question, right? But they still haven't figured out a way to get stimulus checks to people who don't file a tax return, right? So, what does that mean? I mean, everybody knows that people who don't file tax returns are incredibly vulnerable right now, and that if we don't protect them, we can't protect the rest of us. But that didn't carry any weight. Also, we haven't built systems to even connect to them, right? So, and yet those are the people that we also need to be able to mobilize, and that doesn't come easy, right? And this is why I think we both need to, how do we respond in the moment so that we can build power over the long term? There are opportunities right now, but there's also it's an architecture of organizing that has to happen over a long term.
Yeah. Tying off that last point, we're wondering kind of how, there's maybe a natural alignment between issues of public health and issues of the environment. Can you talk to maybe the potential policies that might be part of a, say, Green New Deal for public health?
So I think some of the most exciting visions of the Green New Deal I have seen have been explicit that, in fact, part of the Green New Deal is about a jobs program, because we need to care for each other and create social infrastructures at the same time as those jobs should be green jobs. Those jobs should be building the energy efficient homes that we need, right? That they should, but also, if you think about the book that Alyssa Battistoni, Aronoff, and their co-authors wrote, there's a big chapter in there about care work, and why care work, in part because the legacies of environmental racism mean that communities of color are more vulnerable, and there's a legacy of all these kind of healthcare costs that we owe to one another. The Green New Deal has to be a kind of I think a politics of solidarity to work as a politics, and then care has to be part of that. And so I think those visions of the Green New Deal that see care as a part of that, care for our environment, but also care for one another, I think are really compelling. I think that's kind of part of the connection. The other piece is that, we really can draw on the legacy of federal works programs, some of which had, building trails, had environmental, addressing malaria, right? That had environmental components to them. They've worked before. We can put people to work in these ways and build the future that we need to, with some of that work being care, and some of that work being care for our environment, and building the new infrastructures that we need.
Absolutely, yeah. I think part of it is eroding the old sort of tension between the environment versus the economy, and trying to bring those things together and incorporate things like public health and Medicare for all and a just transition into kind of this deep environmental legislation around the Green New Deal. So I guess for our last question, do you have any concrete actions that our listeners can take kind of in pursuit of that Green New Deal for public health, or other laws and legislation that will bring us towards it, both in the short term or the long term?
Yeah, I think honestly, the most important thing that you can do is get involved with organizations like Sunrise. There's other wonderful organizations out there, but what we need over the longer, even the short term, but also the long term, is organizing, right? We need to, it's great to call your senator and call your congressman, and you should do that. When somebody smart asks you to do that, you should do that. But you should also find other people you admire, organizations you admire, and just simply say, what can I do that's useful for you? And if that's like mailing letters, then mail letters. If that's organizing a Zoom call, organize the Zoom call, and then you'll learn how to write the policy papers and build the connections. I think, on top of that, right now, there's all this mutual aid going on, and these mutual aid organizations, and you can find your Google spreadsheet. I think those are great ways to also get connected to your community. We need to know our neighbors, and we need to be in a relationship of solidarity to one another. I think those mutual aid groups are providing interesting examples of how to do that aren't themselves the change we need, but that might help us build connections to one another in our localities to become the change we need. And then you should read stuff. You should read about the Green New Deal, read about these historical examples of things that work, like the Works Progress Administration and Civilian Conservation Corps, right? How do we build the political constituencies? That is by learning our histories and learning from other efforts to organize. Those are things that we should be doing now too, on top of the normal call your senator when someone smart tells you to do that.
Amy, thank you so much for joining us today, and I hope you have a great rest of the day.
Thanks so much for doing this, and good luck.
Thanks so much.
Huge thanks to both Amy and Julian for that interview. Sorry about any technical difficulties. It's hard to know what Zoom is looking at sometimes. We are running a tiny bit late, so I would like to jump straight into our questions, if that's all right with everyone. Sarah, are you with us?
Yes, my video was stopped.
Oh,
The host.
sorry. Let me, there, that might help.
Awesome. Yeah.
Great. I just wanted to ask you a question that was brought up in our interview that I think is really important and hasn't been touched on enough. But could you comment on the subject of mental health during the COVID crisis and also the oncoming climate crisis?
Yeah, absolutely. So there are a few things I've really been thinking about, and one is the burden of social isolation and loneliness that can happen when people have to physically distance themselves from one another. But prior to the pandemic, I had been working in a geriatric psychiatry clinic as part of my training, and already saw that there was a huge burden of that on older adults throughout our community. And so that's something I've been thinking about recently. And I think efforts like this to bring people together into social connection and meaningful activities together during this time is so important. And then I'm also, I mentioned earlier my colleagues who I worry about in hotspots like New York City and Detroit, and thinking about the long-term impacts on them psychologically, perhaps, trauma and PTSD arising from just the complete overwhelm of the healthcare system, and then also for families and patients who encounter the healthcare system in such a chaotic state, or who are not able to be with their loved ones when they're so critically ill. So there are certain efforts going on to try to bridge those gaps, but that's one thing I'm really worried about. And also just the burden of worry and stress around job loss and loss of health insurance that's often accompanying that job loss. And so I think that it's hugely important what the Green New Deal is offering around a job guarantee, thinking about healthcare as a human right and not as a market commodity, because it really is an accident of history that health insurance is employer based. So after World War II, that's when that whole system of having employer-based health insurance came up, and then there have been more and more there's more and more marketization of healthcare instead of having it be treated as a human right. So I think the Green New Deal is going to be huge in addressing the mental health burdens of our current situation.
Yeah, I think it's not discussed enough how much just the material situations of people contribute to kind of this mental health crisis we have. Linda, I want to ask you a question. This is from Gersh. Is it legal for hospitals to fire workers for speaking out about unsafe work conditions? And do we need new laws to protect whistleblowers?
I can't answer that question. I don't know. It certainly doesn't sound right, but that's a separate question than whether it's legal. So I'm sorry that I can't answer the question. I do think it's really important that we have strong whistleblower protections. We've just seen that over and over again with the Trump administration, that when people say things that he doesn't like, they risk losing their jobs and their livelihoods. And we do depend on whistleblowers to let us know when things are happening, whether it's inside a big company or inside an agency in government. So I think that's really important.
Thanks for sharing that. I have a question from Carla. She writes, I was once an aspiring med school applicant. I was disappointed that I did not see holistic healthcare being delivered to patients in the language of their choice, and I decided I could not proceed with a profession that did not value holistic care and instead issued medications per consultation with a patient. Is this changing, or is this something we can expect to see in the future unless medical school changes their missions and the healthcare system begins to build that type of vision? That's a question.
Well, I'm going to answer. I hope that Sarah will answer that question more directly. But I started out as a clinician. I finished medical school, and what really frustrated me working in emergency medicine and pediatric acute care was that we were taking care of patients who, in the end, we were going to send them back into the same environments that had made them sick. So in addition to thinking about what constitutes holistic health care, I think we really need to be thinking about what constitutes health. And we know that probably only 10 to 20% of health outcomes are attributable to health care. The vast majority of our health outcomes and our adverse health outcomes and our epidemic of chronic illness comes not because people don't access healthcare, although that's certainly, as we're seeing now, a huge issue. But it comes from the social conditions, the economic conditions, the services that people have access to, what we call the social determinants of health. And that's why the Green New Deal, if it includes what it needs to, is actually a health New Deal as well. When we are stuck in our cars, we're getting diabetes and we're becoming obese and we're getting heart disease. When we're living near busy freeways or near oil refineries, our kids are getting asthma and we're getting chronic lung disease and heart disease and adverse reproductive outcomes. So when I think about what is, quote, holistic healthcare, I think about creating healthy conditions. Healthy people only emerge out of healthy places. And of course, healthy places require a healthy planet. So that's my 2 cents on what is holistic in terms of health.
Thank you so much, Linda. I would just add, in terms of the seeing problems in how the health system functions, or inadequate care for people who speak multiple languages or are non-English speaking. I definitely think that part of what contributes to burnout in medicine is a process of becoming demoralized at seeing ways that the health system is inadequate to meeting the needs of our most vulnerable patients at certain times, and not providing the most sensitive or good care to people, particularly who have faced discrimination or where there is unconscious bias within the healthcare system. But something that really has given me hope around that is seeing different examples and pockets of innovation. And I think there are really good people within the healthcare system who are working on trying to make those inequities less and less. There's a movement called White Coats for Black Lives among medical students to address racial injustices in the health system. I know at San Francisco General Hospital, there are many different initiatives, including in the pediatrics clinic. The residents worked really hard to develop a system with video interpreters and to train everyone on really good practices for using healthcare interpreters. So those are just some examples of things that give me hope in that regard.
We have a question from Jenny. If we still need PPE for the healthcare sector, how are we going to safely reopen the economy? Do you think we're ready for that transition right now?
Well, we need more than PPE. What we really need is more testing so that we have a better way to understand what's happening with this pandemic and where there's hotspots. We need to be able to test people that have symptoms so that we can protect healthcare workers appropriately. And we need to be able to use testing to do the appropriate contact tracing and then isolation so that when cases do emerge, we can essentially put a ring around them so that we don't see a lot of spread that creates another surge in cases and in overwhelming of our healthcare capacity like we've seen. So PPE is obviously a really critical piece of that. It's absolutely essential that not just healthcare workers, but all the other essential workers that we rely on to get us our food and keep the supply chains running and so on, also have the right protective equipment. But I would say the number one barrier right now to returning to normalcy is the lack of adequate testing and the surrounding infrastructure for contact tracing and isolation.
I totally agree with Linda on that. And I would also add, since this virus is going to be with us for a while until we have a vaccine, there's also an opportunity to think about creating PPE that is actually meant and safe to be reused, and thinking about the sustainability implications of that too.
Mm-hmm. Yeah, I mean, our response in the US is so much different than that in some of the Asian countries where they really have kind of testing widespread, and that's the sort of response that you would need to even think about reopening the economy in a large way. So I find it like it's insane that it's being talked about as if it's it should have happened by Easter, right? Like that was a crazy kind of thing to say. A question from Kyle. Would it help if, in addition to pressuring our local, state, and federal government reps, we citizens also called the hospital administrators and companies who could be helping to reinforce the demands that the professionals get the support they need?
I'm not sure. Yeah, I'm not sure if I can answer that. But I think definitely calling on elected officials, and then maybe connecting with nursing or medical unions on ways that community members can be in solidarity with them, like John was talking about earlier.
Mm-hmm. Let me see. We have a question from Adam. Why is the Green New Deal for Public Health team so cool? Maybe one final question. Amy, in her interview, talked a lot about the importance of movement organizing in the movement for a Green New Deal and for a better public health system. So could both of you talk about your own sort of experiences in, Sarah, I know you're also a Sunrise organizer. So can you kind of both talk about how you see organizing, how you see the work of organizing to actually get these demands for a better public health system?
Sure, yeah. You know, I think I'm still learning all the time about that and about what solidarity means. But I think, you know, I first joined Sunrise after a couple experiences where I really felt the unfairness of the impacts of climate change. I had done research in a community in South India that was totally overwhelmed by a horrible monsoon season that displaced millions of people. And I just couldn't stop thinking about how unfair it was that those communities were bearing the brunt of a disaster that was made worse by climate change when they had done so little to contribute to the cause of it. And then in the United States, kind of after that experience, you know, when we were facing the wildfires here, I was on the labor and delivery service at Kaiser Oakland, and you know, the smoke was in the air, and thinking about these little babies that are just being born and they've done nothing to contribute to this crisis. And so I think trying to really stay in touch with like fairness and equity and how that has to be a huge part of how we approach solving the climate crisis. So that's why I joined Sunrise, because I really love the Green New Deal and its focus on equity. And I also think that as I've been kind of a new participant in this movement, it's been really helpful to learn from and talk to older generations of environmental justice activists. I've connected with some of the leaders and Physicians for Social Responsibility who have been in this for a long time as well. And so those are some of the ways I'm trying to educate myself and keep centering equity.
And I think we have time for one final question to Dr. Rudolph from Johnny. Which countries do you think you feel have very good public health systems, and how did their citizens organize to get that system?
I'm not an expert on international public health. I can say that some of the countries that have the highest life expectancy are the countries that have strong public health systems, but even more importantly, have strong systems that allocate more resources and have less inequities, economic and as a result, health inequities. So many of the Scandinavian countries that have good support for parents, they have much more access to education, they have better social safety nets. So those are the countries that have the best health outcomes. You can look at a place like Cuba that for a very poor country has done a very good job of providing decent health outcomes. So I think it really comes back to this issue of which nations make an effort to provide healthy environments, healthy social environments, healthy physical environments. And for me, that's the most amazing thing about the Green New Deal and why it's so legitimate to say this is a Green New Deal for public health. if we transform our energy system and we build healthy homes that don't have gas and coal and oil as our energy source for lighting and heating our homes, if we get out of our cars, well, electrify our cars, but even more importantly, get out of our cars and have decent public transit systems so that we can walk and bike and use public transit. If we build local and sustainable agriculture systems that really make it easier and more affordable for people to eat plant-based diets, if we green our cities and give people access to parks and green space, those are all things that are going to reduce our greenhouse gas emissions and address the climate crisis, and that will return incredible, very rapid health benefits. So we should all be mobilizing to do those things as urgently and as quickly as we can. And the COVID crisis, if anything, shows us what's possible. And I'm just really excited to see all of the youth in the Sunrise Movement rising to the occasion so that you're going to contribute to making a healthier future for everyone. So thank you.
That is such a perfect positive note to end on. So I just want to thank, again, our panelists, Linda and Sarah, for being here. You guys have been awesome, and we're really looking forward to releasing those videos with you in the coming days. Huge shout out to the whole team who helped put this panel together: Elizabeth, Mukta, Julian, Adam, Johnny, the entire Earth Day planning team. And before we go, I just want to share once more, we have 2 open meetings coming up the next 2 Sundays, April 26th and Saturday, sorry, May 2nd. So if you want to get more involved in Sunrise Bay Area, meet some of us and see, how you fit in this broader movement, please go check out this link. Thank you, everyone. This has been awesome. Really appreciate your time. Thanks for being here.
Thank you.
Thank you so much for having us.